So we all have our stories relating to incontinence, and for most of us, before we have any sort of experience, we think it's to do with old people who smell of wee and have to wear incontinence pants. If you've had a child, a natural childbirth, for me personally, it came across in an adventure boot camp when I was on my own with this poor male instructor who made me do star jumps and then some sort of floor exercise afterwards, and there is no black that is black enough to cover up what happens next, even if it's a little bit. It's just mortifying, and I never went back again. So, Natalia, is that normal?
No, it's not normal. It's a very common experience, and it's a condition that is called stress urinary incontinence. We definitely should not be leaking urine when we jump or run or sometimes just stand up. And lots of women do not express this as a complaint when they come to see their gynecologist. And I'm always fascinated when I see patients who finally decide to disclose the situation, what they're experiencing, who probably or quite often saw another gynecologist who might be even a urogynecologist for a routine visit for a pap smear, but they're too embarrassed to share their urinary incontinence with their doctor who specializes in treatment of this condition. So unfortunately, this is something that is very much a taboo, and women are embarrassed to talk about it until they reach some point where they just can't live with it anymore, and then they look for help. So what are the options? I'll go through the symptoms and options for various symptoms. So we'll start with hot flushes or night sweats. The estrogen, for example, Femigel, is the most effective treatment of hot flushes and night sweats. We can administer non-hormonal treatment such as supplements, and for example we've got various combinations on the market. This is Menofem, and it contains wild yam and black cohosh and a number of other herbs that have been studied to help with menopausal symptoms, and this will be useful for women who are trying to avoid hormonal treatment for one or another reason. Unfortunately, natural treatments are not as effective as standard hormone supplementation.
What's the difference between hormonal and non-hormonal treatments?
So stress urinary incontinence is involuntary leaking of urine during exercise, sneezing or coughing, or running or jumping, or sometimes just standing up. And this condition is common after childbirth, as we age, in women who develop constipation for one or another reason, or develop chronic cough, possibly because they've started high blood pressure medications, and that caused the cough, and then suddenly they start leaking. Sometimes women have flu, like in COVID it was quite common, they start coughing too much and suddenly there is weeing going on. So there's a number of conditions that prerequisites that may be in place to worsen stress urinary incontinence. The management of the stress urinary incontinence would include pelvic floor exercises, first of all, and that's where we start. It's safe, can be done at any time of the day, but almost impossible to follow for majority of women. So it's quite often that I ask when women come to see me and I ask them if they do pelvic floor exercises, the answer is, oh yes, they're supposed to be doing them and they know all about it, and they might have tried once, or they might have tried twice. Some even have gone to physiotherapists to be taught how to do them correctly. But unfortunately, women struggle to adhere and do it continuously through their lives. But it is something that's got to be done continuously. It's quite helpful to follow a good bladder routine or drinking routine, so drinking lots of fluid, preferably water, understanding that tea and coffee are diuretics. They will cause you to run to the toilet more often, and so will all the fizzy drinks. So avoiding that or having awareness of its effects on the bladder is important. Bladder training, such as emptying the bladder every 3 hours or so and not every 10 minutes, helps. And we have an Emzella chair that is quite helpful for stress urinary incontinence. It's a high electrical, it's high intensity electromagnetic impulses that stimulates nerves in the pelvis, which then cause muscle contraction. And in one session of 28 minutes, woman experiences over 11,000 Kegel exercises. It's an excellent treatment for mild to moderate stress urinary incontinence, as well as urge incontinence or mixed incontinence. If all the treatments I described have not helped, we then would discuss surgery or sling procedure, which is operation performed under general anesthetic in the operating room, and a sling or a mesh type of tissue is inserted under the urethra through the cut in the vagina. It's a very effective operation with a success rate of 95%. However, as any surgery, it's got side effects or potential complications such as bleeding, infection immediately after surgery. And in terms of long-term negative effects, it would be erosion of the sling, where the sling is exposed in the vagina and it has to be removed, or the devastating complication of the surgery is pain during intercourse. Women have procedure for improvement of their quality of life, such as stopping leaking urine, and they end up not being able to have sexual intercourse, which becomes a huge problem. And in some countries, sling procedure is no longer allowed, such as UK. Hence, they create slings with native tissues and perform other surgery for treatment of stress urinary incontinence. So any surgery has issues, and this procedure is safe and good if performed correctly, but even in those cases there could be long-term complications. Hence, we only do the surgery when other treatment failed.
What is incontinence?
Incontinence is involuntary leaking of urine, if it's a urinary incontinence, or faeces if it's fecal incontinence.
And are there different types of urinary incontinence?
There is stress urinary incontinence, leaking when one jumps or sneezes or runs or coughs, so with any kind of strenuous activity. There is urge urinary incontinence, which is basically running to the bathroom and not being able to make it on time, and that's also quite common. There is an overflow incontinence when there is some kind of leaking that occurs due to obstruction, or functional incontinence where urine leakage occurs because of an obstacle on the way to the toilet. So it could be immobility, or it could be psychological reasons, or it could be structural reasons in the house.
When should you consult your gynecologist if you think you have incontinence?
When you have incontinence, you should consult someone, whether it's a general practitioner or gynecologist or urologist or physiotherapist. Incontinence is a disease that should be treated to improve your quality of life. If your quality of life is not disturbed by incontinence, I guess then there is nothing there to address.
What is urge urinary incontinence?
So urge urinary incontinence is leaking urine before getting to the bathroom, due to inability to reach bathroom on time. And quite often women with urge urinary incontinence have urgency, have this desire to pass urine that they cannot control, and as a result they have little accidents before they get to the bathroom. The condition that is associated with urge urinary incontinence is overactive bladder, and you can hear from the term that it's a hyperactivity of the bladder, so bladder contractions happen more than they should, and that leads to urgency. There could be multiple reasons for overactive bladder, anything from bladder infection to bladder tumor, or more often we don't find the reason for overactive bladder, and it may occur with aging and quite commonly with vaginal atrophy or thinning of vaginal skin, which would be associated with a genitourinary syndrome of menopause. The treatment of urge incontinence starts also with pelvic floor exercises to strengthen pelvic floor muscles. Also bladder diary, where we watch what we drink and how often we go to the bathroom and how many milliliters or how much urine we pass with each visit to the bathroom. And that is to create awareness what creates urgency for you. And it's expected that, for example, tea and coffee and fizzy drinks will lead to urgency. And having awareness will help you deal with the problem. If pelvic floor exercises and bladder training does not resolve the problem, we can prescribe medications that help to stop bladder contractions and treat urgency. And there is a number of medications on the market for this condition. Also, treatment of vaginal atrophy or thinning of vaginal skin is very important because that itself can cause urgency, and treatment will stop the urgency.
Does the Emsella chair help urge incontinence?
Yes, Emsella chair does help with urge incontinence, and we have great results because it's our pelvic floor exercises on steroids, which one does not have to adhere to. You just have to come and sit on the chair fully dressed. Your course of treatment is 6 sessions, 28 minutes each, and you can do sessions 2 to 3 times a week. One can also do ultrafem treatment, which helps with incontinence, with stress and urge and mixed incontinence, and it works through increase in collagen fibers in the vaginal skin and shrinkage of existing collagen fibers, which will provide thickening or rejuvenation of vaginal skin and support to the urethra, treatment of vaginal skin thinning, and as a result improvement in symptom of incontinence.
What is overflow incontinence?
So overflow incontinence happens when the bladder doesn't empty completely when you urinate, and afterwards there is a dribbling of urine. Overflow incontinence can be caused by obstruction in the urethra, by tumors, stones, adhesion or strictures or inflammation.
How do you treat overflow incontinence?
The overflow incontinence can be treated with all the measures that we've described before, such as pelvic floor exercises, but the catheter will be something that will sort out overflow incontinence, and of course one has to remove the cause of the overflow incontinence.
So what is functional incontinence?
Functional incontinence, functional urinary incontinence is involuntary leaking of urine due an obstacle in reaching the bathroom, which could be a physical obstacle such as inability to open the door, or impairment such as immobility, like people in wheelchairs who have to move to the bathroom to pass urine if they don't for example, there is an issue with self-catheterization, or it could be psychological reasons for functional incontinence. And the treatment of functional incontinence would be based on sorting out whatever the cause of it is, or working around the cause. For example, people who are paraplegic or have some kind of mobility issue, stopping them from going to the bathroom would be catheterizing to prevent the incontinence.